Hey guys, it's Dr. Susie G here, and in this presentation, I'm going to talk a little bit about what is chronic pelvic pain syndrome or male pelvic pain syndrome. And first off, I want to start by saying that it's not chronic, it's persistent. It might be annoying and certainly frustrating, but it is definitely hopeful. And if there's anything that you take out of this presentation today, is that pain can be hard, but it is certainly hopeful. And then recovery is possible. It really is possible. And I know it might not seem like that for you today in this moment, but I'm hopefully going to shed some light on a topic that is certainly difficult and very taboo to talk about because we're dealing with your genitals. So, well, let's get to it. I'm going to share my screen with you. Okay. Reading my introduction. So before we kind of dive into the nitty gritty about male pelvic pain, let's go over some brief anatomy here. So the pelvic floor is a fibromuscular hammock. It is formed by the pelvic diaphragm, which is right underneath here that you can see. The perineal membrane, which is a fascial connective tissue type connection that is connected to the front of the muscles here around your penis and also around your bladder and your prostate. And it's supported by the abdomen, the hips, your back, and the fascial integrity and the structures of the reproductive organs within this whole pelvic bowl here. Male pelvic pain is actually fairly common. It ranges widely from 2 to 17%, and nearly 1/3, that's about 50% of men will experience symptoms of pelvic pain syndrome or chronic prostatitis at some point during their life. And it's the most common diagnosis in men less than 50 years old. So really, guys, it's more common than we think it is, and like the flu or the cold. And there's over 2 million guys a year in the United States alone that go to their urologist or go to their primary care doctor that complain about pelvic pain-like symptoms. What are these symptoms? So you can have pain, which is pain after ejaculation, pain with an erection, and painful bladder pressure symptoms, pain in the rectum, pain during or after having a bowel movement. You can also experience pain that goes to the penis, the prostate, your testicles, the tailbone, your groin, inner thighs, your belly, your lower back, or your pelvic floor. Some lower urinary tract symptoms, so it can be anything like burning or stinging during or after urination, difficulty initiating a urine stream, feelings of incomplete emptying, waking up at night to use the bathroom more than twice in a night, feelings of urgency and frequency, like you gotta go, and having dribbling or a little bit of incontinence after you go pee. Bowel disturbances can be feelings that you have difficulty emptying your bladder, pushing or straining to have a bowel movement, inconsistent stools, and pain with or after a bowel movement. Sexual dysfunction. So it's really common to have sexual dysfunction issues such as premature ejaculation, erectile dysfunction, and I mentioned here hard flaccid, which is when the penis feels hard or rigid in the absence of being aroused. And that can happen very sporadically and randomly throughout your day. And many men actually have complaints of hard flaccid. But the thing is that there's not really a lot of information about hard flaccid in the literature and the evidence in science right now because it has just not been studied. But we are hearing you guys, and we certainly pick up on this is definitely something that needs to be addressed and in the holistic plan when you're getting treated. So again, it's very common to have sexual dysfunction in addition to having pelvic symptoms. And on that note, I like to say that The psychological impact is another symptom that most men will experience, such as anxiety and depression. And it is certainly an area that is not easy to deal with. It's not an area where for example, if you hit your thumb and you have a gnarly scar somewhere that you can show people and say, hey, look what's happening. We're dealing with your private parts. You can't really show your penis to people, to your friends, and say, hey, this hurts. So I am here to totally say that I acknowledge that this is certainly a very frustrating and taboo situation that many of you guys are dealing with. And a lot of these are symptoms, and what you're experiencing have also not been appropriately managed by the people that you're seeking help from. And I will be the first one to say I am truly sorry that you're having to go through many different providers to find help for what's happening. And it's not necessary. So hopefully, again, I hope after this presentation you'll be able to recognize that our treatment strategies, our approaches towards treating pain that are certainly up to date in pain science and that have been proven very effective. So, okay. So what are the causes of chronic pelvic pain syndrome, or I like to call it persistent pain syndrome? To begin with, before I read and rattle all these things off, there is no cause of pelvic pain. There isn't one cause of pelvic pain. Actually, no scientific literature out there can point to a specific cause and effect leads to pelvic pain. But there are some potential causes of symptoms. These potential causes could either be current contributors and mediators or perpetuators of your symptoms, or they can be in conjunction with all of these things that are happening at the same time that create the perfect storm. So I've listed a few things here, like gastrointestinal disorders, like IBS, which has been shown to have an association with pelvic pain syndrome, gut dysbiosis, which is just a fancy term for altered gut microbiome, those little buggers in our bodies that help to really keep us healthy and strong. Sometimes they're not playing along nicely. And so whenever we have an imbalance or an overload of what's happening inside under the hood, it could definitely create inflammation in the body and a whole other slew of cascade of things that is just for a whole nother topic for a whole nother day. Autoimmune disorders, neurogenic mechanisms with pelvic pain, they're looking at to see, what are these inflammatory markers and why are they specific to perhaps the prostate or the urethra that would actually create inflammation in the body or inflammation in the end organ, which will sensitize danger sensors in those tissues. And when we sensitize danger sensors in those tissues, that's when you're going to have the message going up to the spinal cord and to the brain saying, hey, we need to do something here. We need to protect you. And so again, these are just potential causes. In my opinion, I do think that this is more of a bunch of different protective mechanisms that are at play when we're dealing with pain. You can have direct trauma, surgery, infections, sexually transmitted infections, UTIs, herpes, Epstein-Barr virus, chlamydia, unidentified pathogens. Again, none of these are necessarily always lead to persistent pain or persistent chronic pelvic pain, but it certainly can be a trigger. History of sexual, emotional, and physical abuse or trauma, pelvic floor dysfunction, peripheral central sensitization or neuroplasticity. Again, this is the concept that I was talking about earlier with autoimmune, is what's keeping the nervous system and what's keeping the brain on a heightened sense of alertness or awareness that consistently is sending the message as an output of you need to take action and you need to be protected. Now, again, that's not always the case of protection being needed all the time. Sometimes, again, you might have these signals and they're not really necessary to protect you. And that's most oftentimes the case with pelvic pain that has been lingering on for more than 6 months, for years. If there was a trigger, if there was an injury, most likely those tissues have healed long by now. And if there is lingering pain, and not just in the genitals, but in pain in general, and for anyone who's experiencing pain, you need to look at deeper mechanisms and pathways that are contributing to your experience of pain. And so that's what we bring in the nervous system, and what are the neurological changes that happen here. Psychosocial, again, we're looking not only at the biological contributions to pain, but also the psychological and the sociological impacts that pain has. Now, psychological impacts are, thoughts, emotions, fears, worry, anxiety, and the social impacts are, your support system, your family, your friends, work, what's happening in politics, what's happening in healthcare. So, all of these things are going to shape your experience of what's happening in your body. And I already mentioned this, but the perfect storm, in my opinion, I think it's a combination of multiple mechanisms here at play that are trying to protect you. It's been a widely known myth that chronic prostatitis or chronic pelvic pain syndrome is due to the prostate and infections. Lots of research has now shown that over 95% of cases are not due to an infection or inflammation. So it's usually the case for most individuals who are experiencing pelvic pain. And this is typically, again, if you're having pain that lasts greater than 3 months, and there is no known identifiable pathology or known source that is often associated with genital pain, or pain with ejaculation, abdominal pain, or lower urinary tract symptoms and erectile dysfunction. So again, most cases fall into this category 3B, non-inflammatory chronic pelvic pain syndrome. I bring this up because most men that I see have been treated with a lot of antibiotics. And antibiotics, they're not necessary, again, in 95 to 97% of cases, but they're being overprescribed and overtreated with. And that does do a number on what's happening in the gut, and it alters the gut microbiome that I talked about. So, antibiotics are great if you need them, and if there is an infection that needs to be cleared. And in those cases, once the infection is cleared, then the symptoms should also resolve. But again, in this case, we're really not dealing with infections. We're dealing with something that's of more of a greater complexity. We're dealing with persistent pain. The psychological impacts of chronic pelvic pain syndrome. Yes, this is a big one for you guys out there. And again, I hear you. I know the frustration that is being conveyed regarding this, because it is certainly an area of your body that holds a lot of value, and it is scary to have pain in your genitals. And it's even scarier when you are trying to get help for it and you go to see all these providers and they have no answers for you. They really don't give you a plan. You don't understand what's happening, and it just creates a snowball of tragedy, honestly. And then a lot of things go on through your head, relationships. Am I going to be able to work? Am I going to be able to have kids? Not having the resilience to go on like this. And it is certainly stressful for many of you dealing with pelvic pain. And the science has shown that the more stress that you perceive during the first 6 months after a visit with a healthcare provider, the more pain and disability that you're more likely to report after 12 months, so after a whole year. And again, the importance here with this is that, again, it's the lack of not knowing what's happening, frustration, anger, feelings of, why me, and fear of, what is the future going to hold for you, and the uncertainty that's around pelvic pain. So again, I totally understand that this is definitely not something that's easy to work through in your life, but it is certainly hopeful. Like I said, it's hard but it's certainly hopeful. And with the right tools and the right mindset and the right training and working with the right providers, that can certainly help you navigate out of pain. You are not the same at any one given moment of time. It may seem like that, but inside your cells are constantly changing and communicating with one another, and on the outside, everything is constantly changing and moving and adapting to the environment. So the fact that you are bioplastic and there is neuroplasticity that can happen, you can certainly unlearn a lot of these pain responses or painful responses to pelvic pain. I'd like to also note that there was a study or actually like a survey that surveyed a lot of men and asked about their quality of life, and the men that reported said that dealing with pelvic pain and living with pelvic pain is just as bad as having a heart attack or living with Crohn's disease. So again, we hear you when you're saying that this is definitely a huge life-threatening issue to be facing. So I've mentioned this earlier a little bit about, what does stimulate our nerves and our nervous system and protection. And so you can see in this graph here, this picture, infographic, there's a lot of nerve sensors in your body. There's trillions of them. And they are designed to sense the world around you and for you and to protect you and tell you something. And there's various different stimuli that can excite these sensors, right? So for example, pressure, a lot of my guys will say when I sit down, the pressure from sitting or the pressure on my testicle or the pressure on my penis will increase my pain. Temperature, vibration, stretch, thoughts, emotions, movement, noise, smell, stress, and the list can go on. And it certainly is very individualized from person to person to person. So everyone's triggers and mediators and perpetrators are very different from one person to the next. And the goal is to really figure out what are these triggers for you and how we can start to eliminate them and eradicate them one by one. And this takes training and this takes lots of practice because, believe it or not, it seems that it came out of nowhere. But a lot of these mechanisms, again, like the perfect storm, have been doing for a very long time. And then it was the final straw that broke the camel's back. And then, bam, we have an SOS signal. Now we have to take care of it. So sometimes it may take longer for some people. For others, it might be very short. But again, it depends on the experience they've had from the beginning of dealing with pelvic pain that really dictates how quickly things will resolve for them. So it's still super important to get in touch with a provider that is going to speak, the languages I'm speaking, because not all providers do know about and are not educated about pain biology or neuroscience. And it is a super important recovery piece of your recovery that needs to be addressed. So bringing me to how are we going to treat pelvic pain, right? So if you can see, bring your eyes to this picture over here on your right. Pelvic pain, we can kind of look at it as, okay, or pain in general. What you have a cup that is filled, let's say halfway, okay? It's not overflowing, so the alarm systems aren't going to go off in your body. But there are certain things that can accelerate this cup to overflow, right? You could either pour too much in it or you can ignite a flame underneath it and it's going to start overflowing. And down here, you'll see that there are various different things that contribute to what causes my cup to overflow. Again, most of you guys do deal with this is fear, failed treatments, family concerns, anxiety, job issues, the fact that you're still dealing with pain, and then having multiple different explanations for what's going on. Again, fear, lack of control, lack of sense of what's happening is going to keep you in that boiled over state, that fight or flight protective state. And as long as there is more credible evidence of danger versus safety, you're going to have an output message. And so I like to say here that pain works like a car. As simply as I can put it, it's more complex than a car, but the car has to, in order for you to put your engine on, there are multiple parts that have to work together in order for that spark to ignite so that you can start your car. And so again, when we're treating pain, we have to look at all of the parts to determine what's filling up your cup, okay? And like I mentioned before, there has to be more safety established, again, in your environment, in your body, in your brain, in your nervous system, so that there's no need for your brain to continue to protect you. I love this, Homer Simpson. No brain, no pain. Again, very briefly, the brain is the CEO of your output messages and what you feel. If you have no brain, there is no pain. So, it's all about really de-threatening the situation so that appropriate healing can start to occur. And lastly, I definitely am super optimistic for you guys. It's important to really stop chasing pain. I know that's a hard pill to swallow and very charged of me to say, but it's about starting to live your life again. And pain can rob many of us from experiencing a very happy and joyful life, but we can choose to let it take us over, or we can choose to have it motivate us to take action in a very healthy and positive way, because there's definitely a lot of ways to take action, but not all of those are conducive to healing. So a life without pain is possible. It certainly is for everyone. And your understanding of the pain biology is crucial. And knowledge is a big analgesic and oftentimes free. So knowledge is power, and this has been shown through decades of research, again, from pain scientists who are studying pains in humans, and they are able to tell us distinctly with facts saying, the more you know about what's happening in your body, the more you know how your body works, the less threatening the situation is going to be, and you're going to experience less pain. Pain is a protector. Don't give it a bad rap. We try really hard to avoid pain, but listen, guys, it is a normal part of life. You have aches and niggles. There might be flare-ups here and there, but don't let that freak you out. Let's not fear pain, but let's establish a different relationship with pain, because it's not permanent. It is transient. And we need to know how we can work with that, and then again change our relationship with how we view pain with ourselves and in our society, honestly. And then lastly, pain motivates you to take action. Not that you haven't already taken action, because I know many of you have done everything to help yourself get out of pain, but it's more of finding the right people and the right individuals and the right message that help create that transformation, that experiential experience in your life where you can start to put the pieces together. And again, part of this is really having a solid understanding of how pain works and how does it apply to you in your life. And ask the right questions, ask your providers, like, hey, how do I know if I have an overly sensitive nervous system? Is this a tissue issue? What can I do to tame the beast? And then, finally, lastly, is approach all this with a peaceful mind. And I acknowledge again that it is easier said than done, but if you practice a little at a time, every day, moment by moment, to just really ride the wave, you are experiencing these sensations and this whole experience right now in the moment of your life. But know that it doesn't have to be forever. So really approaching it with less of aggressiveness, with less frustration, and with less fear will certainly help create that calm, safety response of the nervous system, which will really calm the pain down, really. So instead of adding fuel to the fire, or gasoline to the fire, let's try to take a different approach. So that's it for the presentation. If you want to connect with me, you guys can definitely connect with me by visiting my website at drsusieg.com. I have a ton of free resources out there to help you navigate out of pain. And of course, if you'd love to come visit me in Asheville, North Carolina, I'd be happy to help you and to truly be honored to be a part of your healing journey. So thank you very much for listening. Okay, so I hope you enjoyed that. I know that was probably a lot of information for you to chew all at once, but take it one bit at a time. Again, these are just my thoughts and my what I truly in the past 8 years that I've been working with men dealing with pelvic pain. These strategies have been the best in terms of helping someone really recover and improve their quality of life and really start living life again without that fear. So if there's anything you took out of this whole presentation, I hope that you know that pain is hard, but it's certainly hopeful, and living a life without pain is certainly possible. So I wish you all the best. And if you connect with me, I'll be so excited to talk to you and work with you and help you out of pain. So thank you so much. Bye.